Good morning, y'all. Well, it's morning here, depending on where you're at when you're watching this. Got a hole in my shirt. So the last video, if you have not watched it, I will leave it somewhere in a box. You can click it and watch that. That was part one, kind of goes before what I'm getting ready to talk about. So that video has the full story of finding out that I was pregnant, and then sadly that pregnancy ended up being an ectopic pregnancy that caused me to have an emergency surgery, resulting in the loss of my right fallopian tube. In that video, I touched a little bit on advocating for yourself with your healthcare providers. And so this video, I kind of wanted to dig a little deeper into that, and also kind of talk about how I have been feeling, dealing, and all the things. And so I decided to go ahead and do it today because I'm off today and everyone is gone, so my house is quiet, so I'm taking advantage of that. So for starters, like I said in the other video, surgery was August 12th. I stayed that night. I had surgery at around 8 p.m. And then I went to recovery. It took until about 10, I think. Went to recovery for about an hour, and then I was brought back up to my room. I'm looking at my calendar up here if you see me glancing. And then I was released the following day, Saturday the 13th, to go home. They prescribed me 800 milligrams of ibuprofen and hydrocodone, I think. And the pain, like when I first woke up, was horrible, and I felt nauseous. And so they gave me something for that. I hadn't ate or drank anything since they had called me. So since I had lunch that day, my meetings like 12:45 Friday, I hadn't had anything until like midnight-ish Saturday morning, 12:30 a.m. Saturday morning. I was able to have some apple juice. I do remember that because I sucked it down so fast. I was so thirsty. And ice chips. That's what I wanted. Apple juice and ice chips. And then I still felt kind of nauseous. They gave me some pudding, which I normally hate pudding. I don't like the texture of pudding or Jell-O. But I was just so hungry. So I ate half of that and I went back to sleep. The pain, it was fine if I was still, but getting up and down was horrible. I didn't want to move. And so I only got up to use the bathroom if I had to. But I would just hold my stomach. And, you know, it is what it is. Just hold your stomach. That's all I can say. Just hold your stomach. That's what helped me, was holding my stomach. And so I was told I could not lift anything heavier than 15 pounds or drive for 10 days. My job, I do daily home visits with children 3 and under and pregnant moms. So my boss was like, you're going to do virtual visits for this next 10 days until, you know, you're able to go back to work, which is a blessing. So I was able to do virtual visits with my families, work from home, and do that and still recover and stuff. I did have my follow-up appointments on Wednesday the 24th, and everything looked good. She said I was good to lift, good to go back to work, everything like that. Which obviously, like the prior week, I was able to, drive and stuff. I still was not cleared to lift, so I had to modify like how I did my home visits, because normally you take like activities and stuff into the home. So I just had to like modify what I took to the home for that week until I went to my doctor last week. But that was fine. And so everything looks good. I've been cleared. She said my left tube looked good. She showed me the pictures. And seeing the pictures, like, I was asking my mom and my husband, like, what it looked like, because they said they got to see the pictures. She was able to show them, like, where the baby had, like, placed at in the tube, and why they were having to take the tube and things like that. And I was like, did you, like, take pictures of the pictures? Like, I want to see. And neither of them did. And so I wanted to see. Well, I thought I did until I saw for myself. And I wasn't ready. She showed me the blood. She showed me the before and after pictures. And it was just a very weird feeling. And I don't know how to really explain it. So I kind of talked about how, like, I was feeling in the hospital before the surgery. So after the surgery, obviously, like, I'm just happy I'm alive, because she's been my OB. I've got 4 girls, and she's delivered all except my oldest. So my second oldest is 13. She'll be 14 in December. So for 13, almost 14 years, she's been my OB-GYN. So we have all that history, like, it's been years, okay? She is very honest, open. I'm very open with her. Like, that's why I care about her. She is an amazing, amazing woman who cares about her patients, and the fact that she's also a Black doctor makes it 1,000 times better. No shade to white OBGYNs, but me personally, with my first daughter, I had a white OBGYN, and I don't feel like I got the same level of care or respect that I did when I switched. I was 16 when I got pregnant with my oldest, 17 when I had her. I don't feel like I was taken serious being that young. I also had the same lady prior, because I had ovarian cysts before I even got pregnant, like through my high school years, who told my mom I just wanted to miss school, and they were rupturing, which is why I was in so much pain. And so my oldest and my second oldest are only 15 months apart. So I wasn't that much older when I switched to my current doctor. And she did not treat me any different than if I were 30 years old versus, 18. And I love that. I absolutely love that. But anywho, and so after the surgery, obviously I'm happy she came back from vacation. She told me to come in, and I'm alive. Obviously, I'm happy and thankful to be alive. I am a Christian woman. My upbringing is in the church. I practice my Christianity. I'm Christian. I love God, like, just to put that out there. I'm saying that to say, while I was thankful, feeling blessed, happy, all of those feelings at the exact same time, I was extremely, let me get emotional. I was extremely pissed off, angry, hurt, and confused as to why this even had to happen. And I say that because, like I said in the previous video, you know, like the pregnancy in May, it was not expected, but, you know, we were still like semi-trying, semi-kind of tracking a little bit. But this one, we were not. Like, I was good with not being pregnant. And, like, the fact that we only had intercourse one time during the fertile, and actually, I'm not even sure about that. It's kind of iffy because, like, you know, I wasn't using testing strips. I'm going purely off of an app on my phone. But, and it's like, I was so angry at the doctor who was covering, the doctor that was on call when I got the ultrasound on the 5th, mad at the nurses, mad at my body, and pissed at God. Like, I have been serving you. I have been praying. I've been teaching my kids about you. I go to church. I serve in the nursery. Like, as crazy as this sounds, listing to him everything that I've done, like he doesn't already know. Like, I know that sounds crazy. Trust me, I know. But this is what I was feeling all at the same time as feeling happy, blessed, thankful. I'm also feeling all these other opposite extreme of emotions. And it's like, I couldn't make sense of it in my head as to, if I was not trying to get pregnant, why would you allow me to be pregnant and not only lose that baby, but now I've had to have surgery and lose, you know, one of my tubes. And you know, I was so angry. And it wasn't an anger I kept inside. Like, I was outwardly angry for two weeks. Like, I'm still a little at times. Like, I'll catch myself now, like, here and there, and I'm like, whoa, like, take a minute. But, like, just outwardly, like, nothing could make me happy. I was happy, but I was angry. And I don't know how to explain it to you if you've not ever been in that type of mood where you're so happy to be alive because you have this family and this life that you prayed so hard, God, please don't let me die during this surgery, or please don't let me die because, you know, you got a call that you're bleeding internally. So you were thankful and blessed that he allowed your doctor to see that and save your life. But you're also pissed off because I didn't ask for this. I didn't ask to get pregnant and then not only lose the baby, but then, you know, to have it be this extreme. And so I was really struggling with that. And to add on to that, I was struggling with how I was feeling because I did not feel right being mad at God. Someone, you know, my biological father and my stepdad are both ministers. And so when I say I was raised in the church, I was raised in the church. And, you know, I didn't feel right being mad at my creator. Like, and regardless of what your personal beliefs are, I'm speaking on how I felt and how I feel. I did not feel like myself is what I'm getting at. And so having all of those emotions, all of those feelings, I felt extremely scared, lost. I still don't 100% feel like myself. Like, I know, like, it's gonna take time. I know, like, my body still has to go through that process of hormones coming back down and going through that process. And the only difference is there's no baby here to justify why, you know, my hormones spiked up and then came back down. And so it's just been extremely weird and a very up, down, round and round emotional roller coaster. And I've been very closed off from friends, family, my husband, like, and this is just me being completely transparent. I'm not on here to make it seem like life is great, make it seem like I'm doing 100% fine, because if anyone is going to get on YouTube and search for someone that they can relate to or that has gone through something like they have, like I do, I want them to hopefully find this video and not think there's something wrong with me because she went through this and she's all rainbows and sunshines. I want them to find my video and see if they are struggling, it's okay. Like, I'm not going to get on here and pretend that I have been the perfect mom, perfect mother, perfect daughter, perfect sister, perfect friend since going through all this, because I haven't. I've actually been a craptastic person. I've tried my best. You know, I got up, went to all my kids' open houses. I've been making sure they've gotten to all their practices, done everything, you know, that I'm supposed to do, checked off all my boxes, did everyone's hair, got all their outfits together. But inside, I just feel like I'm going through the motions. And it's not, I'm not angry at my kids, obviously. They've done nothing. And I still have that joy and that love inside for them. I don't have any feelings like I want to leave this earth or anything like that. Let me put that out there. That has not come across my mind. I'm just still in this dark, angry, lost place that I'm trying to make sense of everything. Today is August 29th, so it's been 2 weeks and 3 days since the surgery. So yes, it's still very fresh, and yes, I know it's going to take time, and someone will comment or say to themselves, you need to get therapy, you need to get counseling, and maybe you're right, maybe I do. And when I feel that I'm ready to do that, maybe I will go back to my therapist. Maybe I won't. I don't know. I can't give you an answer for that. So that's how I've been feeling. That's how I've been dealing. When I feel like I want to talk, my mom is amazing. She is there to listen. My dad is amazing. He's there to listen. My sister is amazing. She took me out this weekend. We were just chilling in the house, having a couple drinks, and having fun, laughing. My cousin came into town. We decided to go out, and really we sat outside of the local bar here where we live, and people watched, and they were laughing at me because I wanted to ride the little electric scooter up and down the street. But I mean, I have people to talk to when I'm ready to talk. It's just a matter of I don't want to talk yet. You know, I have my best friend, my husband. He deals in a different way. He copes in a different way. So trying to find a time to align where we both are able to talk about it at the same time has been our biggest struggle, I feel like. And so I feel like there will come a time where we are both able to sit down and have that conversation. You know, my stepson, Kaori, my bonus baby, passed away in 2019. He was only, anywho, so he's had his own share of loss, and so then so it's a whole thing. I do think there will be a time where we both are able and ready to come together and talk about this situation. It's just not right now it's still too fresh. But yeah, the last thing I want to talk about, again, please, 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 especially if you are a brown, tan, black person of color, brother or sister out there watching this, advocate for yourself. And I mean that from the bottom of my heart. I feel like a lot of times we get overlooked, or it's thought, we get pushed aside, or even talked down to, and it's not always, so I can't slap the always label on there, but it does happen, and it happens too much. And if you do not ask the questions, if you do not stay on top of it, if you do not keep on staying on top of it and asking questions, no one else will. And then it comes back on you. It's, at the end of the day, it's your body. And I know, like, it's easier to just accept, oh, they're the doctor, they're the professionals, I'm not trained in that. Yes, absolutely, they are the doctors, they should know better. But you know what you normally feel like. You know what your pain tolerance is. You know what, your normal blood pressure is. You know if your feet are swollen. You know your body better than anyone else, even if it is a medical professional. So if you go to them and you mention something and they don't take you serious, you need to bring it up again. And if they refuse, then you need to tell them that you want it documented in your chart, that you requested more testing and they refused, so that if something does come up, it's in there that you requested it and that your medical professional said no. And then you need to go a step further and find a doctor who is willing to take what you're saying and see if there's something to it. Because I cannot stop thinking about, what if I had not sent my regular doctor all those reports from the hospital I don't normally visit? What if I had just stopped with them giving me the shots and saying, okay, you should be fine? I could have just taken that, and I would have continued to have had this internal bleeding, and eventually I would have died, gotten extremely sick, caused more damage. Like, the list goes on. If I hadn't gone to the hospital that day because the doctor on call just said it's a regular miscarriage and I had already hit my peak, and she just wanted me to keep coming back for more blood tests to see if my levels had dropped again. You have to be on it. Do not accept something just because a doctor says so. That's never required of you as a person. I need whoever's watching this to understand it. Even if you are not a person of color, if you are white and someone's not taking you serious, I need you to advocate for yourself as well. I'm just speaking to people of color because it seems, from experience and talking to the different people in my personal life, that my white friends don't seem to have the same issues that my black friends and people of color friends seem to have. And we all live in this same small butt town and see basically the same network of doctors. And so it's like, well, how is so-and-so getting this treatment but this person isn't? I'll do you one better. Me and a coworker have the same primary care doctor and have one of the same shared conditions. And so we found out we had the same doctor. And she mentioned, oh, well, Dr. XYZ is doing this. And I said, oh, well, I was told to only do this. And so I brought it up and I said, why is it that this treatment plan was offered to this person, but it was not offered to me? And I was told, oh, I didn't think you would be interested because it costs X amount of dollars per month. But you never offered it to me to see if I would be interested in it. You just assumed because it costs something, I wouldn't be interested. It's for my health. Why was I not given the option? So, advocate, advocate, advocate. And this even goes down to your children. If they are telling you something or you know something is wrong with your kids, do not stop. I promise you. Please, please, please do not stop. Continue, and I mean that with everything in me. If you have to change doctors, if you have to figure out, I know if you're on Medicaid, it can be a little tricky. Certain doctors only see certain plans. Figure out a way to make it work. Not all doctors under the same, like if they're in a cluster group, one doctor might agree with that treatment plan, the other doctor could have a completely different treatment plan. Find what works best for you and your family, and then you go with that. You go with what makes sense for you and your family and what you feel is the best option and what makes the most sense for you and what you feel is actually going to treat your problem. Because at the end of the day, for them, yes, you're their patient, but you're the one that has to live with that or not live if it comes down to it. So that is all I have. I know this video and the one before were lengthy. So if you did watch them, I appreciate you. As always, if you have any questions, comments, whatever, feel free to leave them below. Until I see y'all again, be blessed, stay positive.